Hello, hello, and welcome to another episode of 2 Minute Emergency. I'm your host, Dr. Leslie, board certified emergency physician, best-selling author, international speaker, and professional photographer. And I am here once again to bring you facts and information to keep you healthy, safe, and out of the emergency department. So the topic for today is World Arthritis Day. And so I posed a question to you, and I wonder if you know the answer. Can arthritis be deadly? Well, the answer is no, it cannot. So there are over 100 different types of arthritis, and they by themselves are not deadly. That being said, they can reduce your lifespan as they affect other parts of your body and cause complications. So let's start off with the most common type of arthritis, and that's osteoarthritis. And I can tell you personally, my mother suffered from osteoarthritis. So many people do because osteoarthritis is caused by the wear and tear of the joints. So if you have someone who has been active in sports, who does a job that does a lot of heavy lifting on their knees, carpentry, things like that, where you're putting a lot of extra stress on your body. And that includes obesity because that puts tremendous amounts of stress, especially on the knees and the ankles and feet. So when you have these conditions, you're going to have that increased wear and tear, and you have a breakdown of the cartilage. You start to hear that grinding sound when you move. The damage of the arthritis in the cartilage is what causes the pain. So that's the most common type of arthritis. The other thing is with osteoarthritis, that's when you wake up with the stiff joints. And so it usually decreases as your day goes on and you continue being active. And so that's one of the ways of finding out if it's osteoarthritis. Now, the second most common is rheumatoid arthritis. And so we talk about RA. That's what most people call it instead. So RA is actually an autoimmune disease. And as I mentioned before, arthritis is not deadly, but RA is one of the types of arthritis that has complications that can cause narrowing of the cardiac vessels. It can cause scarring in the lungs. It can cause certain anemias. And so as complications, that can decrease your lifespan. And some say up to 10 to 15 years. Now with osteoarthritis, a little bit different. So it causes a lot of inflammation of the joints and can lead to severe damage. Now, it also can cause little nodules, which you can see in the skin. So it may happen, especially in the areas where you have pressure. So on the elbows, on the heels, and those nodules can be very painful. The pain and the stiffness that it's in multiple joints. So typically with RA, you're not going to have just one joint that really bothers you. It's often symmetric. So if you have it in your right hand, you're going to have it in your left hand, most commonly. And it's a lot more severe than the osteoarthritis. So let's jump to the third type of arthritis, and that's psoriatic arthritis. So with psoriatic arthritis, it's a combination of inflammation of the skin as well as the joints. So most commonly, we think of people who have psoriasis. And so that's the skin manifestation where you may have red raised areas or patches. They can become very scaly. And so we usually treat them with steroids, something like that, to help reduce them. There's many products that are currently on the market to help with psoriasis. Now, about 10 to 30% of people who have psoriasis can lead to psoriatic arthritis. So that is usually about age 30 to 50, equal number of men and women who have this problem. And they may have a single or multiple joints involved. And so they also may have puffiness of the face, the eyes, around the eyes, I should say, the hands, the feet. All those are signs of potential psoriatic arthritis. Now, the fourth is something that people hear about all the time, gout. So gout or gouty arthritis. What tends to bring on gout? Well, it used to be called the rich man's disease because it was only affected, or I should say exacerbated, when you eat a lot of red meat, red wine, cheeses, just generally rich foods, a lot of butters and creams, and they would often bring on gout. So what is gout? Gout is an increase in the uric acid produced by the body, and your kidneys aren't able to get rid of it. And so it builds up in the joints, and that's what causes the pain. So when we think of gout, we think of the most common place being in the big toe. Now, it can be other joints. It can be in the ankles. It can be in the elbows, the knees. All of those areas can be affected, but usually it's only one joint at a time. And they become red and inflamed, and it's a very sharp, sudden pain. And it can lessen over time. It can become dull, but if untreated, it can last for many days. So they say on average 3 to 10 days. So there are diets, obviously decreasing that rich diet that can help decrease the exacerbations of gout. And the fifth type is lupus. So lupus is another autoimmune disease, and that affects women greater than men. It's usually women of childbearing age, and it's more common in African American women than in Caucasian women. And with it, you have several signs. The number one sign that we think of is not necessarily the most common, but it's a rash known as the butterfly rash. And basically, it's on the cheeks and across the bridge of the nose. And it's usually red. It can become scaly, and that is known as a lupus rash or butterfly rash. The joints are very painful. They can become swollen, but there are also some systemic signs such as increased fatigue, headaches. You can have other types of rashes and swelling. You can have mouth sores. You can have a lot of sensitivity to the sun. You can have hair loss. Blood disorders are also associated with that. And it can affect all the different organs of the body. So it can affect the heart. So you may have chest pain. It can affect the kidneys. It can affect the lungs. So I would say out of all of them, lupus is the one that affects the body more systemically than any other type of arthritis. So I hope I answered the question of, can arthritis be deadly? By in and of itself, no, but the complications that can be caused as a result of the arthritis can decrease the lifespan. So I hope you learned a little bit about the different types of arthritis, and I hope if you have any of these signs or symptoms that you need to see your doctor. Find out whether you have these conditions and find out more about the treatment. So once again, this is World Arthritis Day, and I am Dr. Leslie, your board-certified emergency physician, best-selling author, international speaker, and professional photographer. And I bring you these tips to help keep you healthy, safe, and out of the emergency department. So until next time, stay safe and stay healthy. Bye for now.